Good afternoon. Today we're announcing our top priority for the next 5 years, building a national maternal health emergency plan. COVID-19 exposed devastating gaps in our systems, and pregnant and postpartum individuals paid the price. We must act now to protect maternal health during future pandemics and disasters. Congress has the power to fund and scale this vision, and we're here to lead, and we're asking you to stand with us.
The COVID 19 pandemic revealed deep cracks in our emergency response systems, especially for maternal health. Akintobi et al. 2025 emphasized that equity must be central to any future preparedness strategy. As a national nonprofit, we have the infrastructure to lead and scale this work. Our goal is to build a resilient, equity driven response system before the next crisis hits. That means integrating care protocols, expanding behavioral health support, and investing in community based outreach.
To jumpstart this vision, we'll deploy a three-tiered strategy. First, we'll expand maternal health infrastructure through nonprofit and federal partnerships. Second, we'll train a culturally responsive emergency workforce to meet the needs of diverse communities. Third, we'll embed maternal health protocols into national disaster planning. And this approach builds on existing Title V programs and OB/GYN response models, allowing us to scale quickly and equitably.
To fund this strategy, we'll adapt to shifting federal and philanthropic landscapes. Foundation List 2025 highlights how nonprofits are responding to tariffs, budget cuts, and evolving donor priorities. We'll engage funders aligned with crisis response and equity, and use our infrastructure to scale quickly and absorb economic shocks. By blending federal, state, and private funding, we'll build a sustainable model that protects maternal health before, during, and after emergencies.
Finland's maternal health system offers powerful lessons for the US. Schmidt and Bachman highlight how universal access, midwife led care, and integrated emergency protocols contribute to low maternal mortality and high equity. These features are adaptable to nonprofit led models and can align with Medicaid expansion. By learning from Finland, we can build a more resilient and equitable emergency response system.
Black maternal mortality is a national crisis, and it intensifies during public health emergencies. Safarzadeh 2025 calls for dismantling systematic inequities by embedding equity into every layer of emergency response. That means equity based triage protocols, culturally responsive staffing, and community defined metrics that guide planning and accountability. These standards must be built into the system before the next crisis hits.
Emergency protocols often ignore the lived experience of patients, especially in maternal health. Haley and Benatar argue that improving patient and provider experiences is essential to advancing equity. We must treat community engagement as core infrastructure, not an afterthought. That means building trust through culturally responsive care, partnering with local organizations, and ensuring patients help shape emergency planning.
Maternal health data is often fragmented and slow, especially during emergencies. Bianchi et al. 2023 called for a national research agenda that prioritizes equity and real time responsiveness. We need systems that track maternal outcomes by race, geography, and exposure to public health crises. These indicators must trigger rapid response and inform policy, funding, and staffing decisions in real time.
The COVID-19 pandemic disrupted maternal care and exposed serious gaps in workforce preparedness. Kotlar found that perinatal health suffered due to staffing shortages and lack of emergency protocols. To fix this, we must train and retain culturally competent personnel and embed maternal health protocols into emergency training across hospitals, clinics, and community settings.
Maternal health is too often siloed from emergency planning and federal funding streams. The World Health Organization 2025 calls for stronger integration of maternal and perinatal health into global pandemic preparedness. In the US, that means aligning Medicaid reimbursement with emergency protocols and embedding maternal health into federal planning frameworks. Cross-agency coordination is essential to protect mothers during crises.
COVID-19 waves worsened maternal health outcomes and exposed systemic failures in emergency response. Ohagbulum show how maternal inequalities and racial disparities were amplified during each surge. These failures must inform how we redesign emergency protocols, staffing models, and funding priorities. We can't wait for another crisis to expose the same gaps.
Emergency response often moves fast, but without ethical guardrails. It risks deepening inequities. Malik and Khan, 2025, argue for ethical leadership in public management, especially during crises. We must apply these principles to maternal health emergency planning. That means transparent decision making, equity centered management, and building trust with stakeholders who are most affected. Ethical leadership isn't optional, it's foundational.
Maternal health equity is shaped by cultural, social, and political dynamics, and these often go ignored in crisis response. But we must mobilize nonprofits, government, philanthropy, and communities around shared equity goals through stakeholder alignment and cross sector collaboration so we can embed maternal health into national emergency planning as a national call to action.
The path forward demands a unified national strategy. Ladakh et al. 2024 emphasized that equity in prenatal care must be embedded into emergency planning at every level. We must blend global evidence, community leadership, and nonprofit infrastructure to build a resilient system. That means mobilizing stakeholders, aligning funding, and standardizing maternal health protocols across emergency systems. The time to act is now.